Thank you, Dr. Olivia, for your nice introduction. Hello, everyone. So I'm very glad to be here today for two reasons. First, this is a great showcase of our science in omega fatty acid. And second, more important, my talk may help you to decide what to eat today's dinner. Well, the answer is simple. So regular fish consumption is widely recommended by multiple agencies such as FDA, along with multiple health organizations such as the American Heart Association. Multiple human studies have shown that fish consumption is inversely associated with fatal coronary heart disease. Fish oil is generally considered healthy because it is a great source for omega fatty acid, such as omega-3, EPA with 20 carbons, and DHA with 22 carbons, both of which are essential for our body's function, and they also provide several health benefits. For example, our clinical studies have shown that both EPA and DHA-rich fish oil significantly improved lipoprotein subclass profile and favorably changed the proteome of HDL, quote unquote, the good cholesterol. Well, in the later slides, I will talk more about lipoprotein metabolism. More significantly, in 2019, REDUCE-IT, a landmark trial using prescription EPA, showed that adding 4 grams of EPA to statin therapy significantly decreased the total cardiovascular events by 25%. That is big. The significance of this study is it resulted in the first FDA-approved omega-3 medication to lower cardiovascular risk, in addition to other medications such as well-known statin in patients with high triglycerides. Besides omega-3, actually, fish oil contains varied types of fatty acids. And in my talk today, I'd like to focus on, first, omega-11, long-chain monounsaturated fatty acid. And second, omega-3, very long-chain polyunsaturated fatty acid, or VOC PUFA, with a carbon chain length equal or longer than C24. Our goal is to estimate the effectiveness of omega-11 AOC-MUFA and omega-3 VOC-PUFA on metabolic disease. So first, let me talk about omega-11 and cardiovascular disease, or CVD. So nowadays, I'm quite sure in our audience, some of you take fish oil supplement, well, including me. Nowadays, everyone takes the fish oil as granted. Of course, fish oil supplement or drugs, that is like forever. But no, the actual first fish oil studies was significantly jump-started in the 1970s study in the Greenland Inuit, where the Danish researchers observed that the Greenland Inuit has a very unusually low rate of coronary heart disease, despite a high-fat diet, especially marine animal fat enriched in omega-3. So we go back to check the very original publication and found, yes, omega-3 is very enriched in Greenland Inuit, but actually omega-11 is also enriched in their diet. So now let's talk about the chemistry. Here shows the structure of omega-11, C21 and C22. They are fatty acids with only one double band. And where they are enriched in, they are found in some very well-known cold water fish species. So first, pollock, that is a primary target for the fish industry in the US. Mercury, among the main commercial fishes in Europe. And sorry, that is widely consumed in Japan. Okay, you may argue, Dr. Yang, I do not eat all those fish, mercury, sorry, I eat salmon, tuna. Okay, here goes the data. And omega-11 actually also found a considerable amount in the most consumed fish species in the US, including satin, tuna, and salmon. So, okay, the fact is, no matter you have already heard it or not, like it or not, when you eat fish, most likely you are also eating omega-11 in addition to omega-3. Compared with well-studied omega-3, little is known about the physiological effect of omega-11 on cardiovascular disease risk factor. So today I will introduce our data from preclinical and clinical studies. First, preclinical findings. So here shows a list of our studies in different metabolic disease animal models. And we showed omega-11 rich diet reduced the cardiovascular risk factors. For example, soy oil for 3 months significantly decreased the plasma cholesterol, improved the fatty liver, decreased the adipocyte size compared with a high-fat control diet in diet-induced obese mice. Of course, this is soy oil. It again contains omega-3 and other fatty acids. One may argue, what if omega-11 rich diet? Therefore, our industry partner Nissi in Japan produced this new fish oil formula enriched in omega-11, and we tested its efficacy for atherosclerosis, one of the major underlying causes of cardiovascular disease. We used 2 atherosclerosis animal models, ApoE knockout mice and LDL receptor knockout mice, and we found omega-11 rich diet dose-dependently decreased the atherosclerotic plaque area. And you could see the red spot, those are plaque area, and up to 80% in animal. So atherosclerosis is a chronic inflammatory disorder. And our data showed that omega-11 first downregulated aortic inflammatory cytokine genes. Second, it also decreased the plasma inflammatory cytokine levels. To further better understand the anti-atherogenic effect of omega-11, our gene analysis data showed that omega-11 activated PPAR signaling pathway and upregulated PPAR-targeted genes in liver. So what does this PPAR do? And there's a long list of review papers on the activation of PPAR and their beneficial in CVD prevention, possibly through first, regulating lipoprotein metabolism, I will touch very soon, and second, inhibiting inflammatory pathway. Stimulating PPAR pathways also lead to enhanced cholesterol efflux, which is a major function of HDL. That's why a moment ago, I said it's in general called the good cholesterol, which contribute to atherosclerosis protection. And our ex vivo data showed that omega-11 significantly increased the cholesterol efflux ability in macrophage and ABCA1 expression cells. So now let's talk about lipoprotein. So you may heard cholesterol, and when you go to doctor check, doctor tell you your cholesterol is high. But after today's talk, you may ask your doctor, which cholesterol you mean high? It's LDL or total or HDL? Because the main lipoprotein, VLDL, LDL, and HDL, they exist in many different subfractions, which vary in their relationship to cardiovascular risk. For example, the small dense LDL is particularly very atherogenic. Further, the recent proteomic analysis showed the more than 200 proteins found in HDL contribute to a variety of physiological roles. So basically, when you heard VLDL, LDL, HDL, they are just purely the sum of hundreds of different types of proteins. So our hypothesis is that dietary omega-11 may result in the change of the quantity of the lipoprotein disease. We conducted proteomics analysis of VLDL, LDL, and HDL from mouse plasma and found omega-11s altered lipoprotein proteome mostly correlated with complement activation and blood coagulation, both of which are known to contribute to the pathogenesis of atherosclerosis. The following correlation analysis further showed that most altered lipoprotein proteome were favorably correlated with atherosclerosis suppression. Okay, you may say all this data from animal as the previous talk. Then what if we do not have animal study in the future? We want to show the data in humans. So since the animal study result is very encouraging, we conducted the first in-human clinical study using omega-11 rich fish oil that obtained investigational new drug approval from the FDA. This is a randomized crossover double-blinded study in 30 healthy participants who are on supplement for 8 weeks. Omega-11 increased cholesterol efflux, had a greater effect on increasing HDL particle size compared with control oil. In terms of LDL, omega-11 had no increasing effect in LDL cholesterol, although the control oil did. For VLDL, mostly like a triglyceride, omega-11 first decreased the triglyceride, also decreased the triglyceride-rich lipoprotein particle numbers. Not only our group, our collaborators in Japan, very soon after our publication, they published another human study in which omega-11 rich fish oil supplement improved endothelial function, possibly through change the gut microbiota. More recently, another study conducted in Norway showed that intake of omega-11 rich fish oil, the blood omega-3 index increased, possibly due to enhanced EPA conversion from precursors. In summary, dietary omega-11 favorably changed the lipoprotein quantity and upregulated the PPAR signaling pathway, both of which contributed to improvement of atherosclerosis. So our initiative in omega-11 research actually has been translated to production. So those shows some omega-11 products across the world in the past few years. So next, I will change my topic just a little bit on the omega-3 VOC PUFA and their effect on eye and heart. Okay, now let's talk about the eyes. AMD, age-related macular degeneration. Today's audience is very young enough. Probably you do not have such problem yet, but that is one of the very prevalent eye disease across the world. It is a leading cause of blindness in the elderly, and more than 18 million people have early AMD in the world. How about in this country? Among persons aged 80 and older, about 3 in 10 had early AMD. That is 2019 data, and this data is still growing. So here shows the symptoms of AMD, like loss of central vision, fast vision, straight lines appears wavy, and difficulties in recognizing familiar faces. Nutrition. Nutrition always plays a very important role in preventing AMD and other chronic disease, as we already know, with emphasis of fish diet and omega-3. As a matter of fact, the epidemiologic studies have shown that omega-3 PUFA and fish intake were negatively correlated with AMD risk. So that is no surprise. Several nutrition intervention studies have been conducted, including ARIS-2, led by the National Eye Institute. This study investigated several dietary ingredients, including omega-3, and AMD development. Now everything looks good. Epidemiologic study recommendation, okay. You may expect me to present some positive study results, but unfortunately, no. The result shows no protective effect of omega-3, EPA, and DHAs on AMD development. And currently, if you go to Costco later today or go to a grocery shop to see the ARIS-2 formula, check its label, you may find there's no EPA and DHA included. While the studies in omega-3, EPA, and DHA is still very, very important, there's a little known about VOC PUFA and their specific role. So, okay, now, the chemistry again, where those VOC PUFAs from? Actually, they are biosynthesized from EPA and DHA through an enzyme called ELOVE elongase, including ELOVE2 and ELOVE4. So therefore, their structure is quite similar to that of omega-3 PUFA, except for longer saturated carboxyl terminal end. The VOC PUFA plays very important roles in specific biological systems, such as retina, brain, and testes. For example, during aging, like us, we're aging every day, and in AMD patients, the retinal VOC PUFA levels were significantly decreased. Because ELOVE2 is involved in the first step of synthesized VOC PUFA, our question is, are there any involvement of ELOVE2 in retinal aging? As a matter of fact, the methylation of the ELOVE2 gene promoter has been shown as a very robust epigenetic marker of age. And here, people know when you talk about a correlation, not meaning that may be the driven reason. So recently, another animal study showed ELOVE2 not only as a marker of age, it's showing as actually a molecular regulator for the aging in the retina. So our hypothesis will be very straightforward. First, ELOVE2 derived VOC PUFA may have potential benefits for retinal health. And second, don't forget that is also a number of omega-3. It may also work like other omega-3 and have potential benefit effect against the cardiovascular disease. Fish oil originally contains less than 1% of VOC PUFA, which means if you want adequate VOC PUFA every day, you need to eat at least a kilogram of fish every day, which is not possible. So again, our industry partner, Nisi in Japan, produced this fish oil-derived VOC PUFA concentrate with more than 40% by weight of VOC PUFA, namely C24-5 and other two moleculars. So first, bioavailability. In our single-dose Gavage study, we confirmed that the fish oil VOC PUFA are bioavailable in serum and retina. In addition, in long-term feeding study, fish oil VOC PUFA are observed into the targeted organs, such as the liver, brain, and eyes. Our multi-organ lipidomic analysis showed that VOC PUFA resulted in the asymmetric lipid remodeling in plasma, liver, brain, and eyes, suggesting tissue-specific physiologic effect of VOC PUFA. for example. Dietary VOC PUFA improved the retinal function in normal mice, such as improved electroretinogram, increased visual acuity, the mice can see better, and contrast sensitivity. In addition, like other omega-3, VOC PUFA also improved the cardiometabolic risk factors, such as glucose metabolism, lipid metabolism in plasma, and the liver. Our transcriptomic profiling provided some molecular insights, and the top regulated gene pathway by VOC PUFA is inflammation, and along with lipid metabolism and PPAR signaling. So why I emphasize inflammation? There's many reasons, and I only pick up one published last month. Well, 2 months, today is November 1st. So the American College of Cardiology reported a scientific statement calling to clinical action to reduce inflammation, which is a robust predictor for further cardiovascular disease risk in even relatively healthy subjects like us, independent of conventional risk factors. And again, oily fish eating is emphasized to reduce inflammation. And why oily fish? Omega-3, such as EPA and DHA, has been known to bind and activate the PPAR, which regulate inflammation and lipid metabolism that participate in the pathogenesis of cardiovascular disease and age-related macular degeneration. So how about the VOC PUFA? Our PPAR luciferase reporter assay showed C24 displayed even greater PPAR agonist activity compared with traditional omega-3, EPA, and DHA. So in summary, fish oil-derived VOC PUFA are bioavailable in liver, brain, and eyes. It improved the retinal function and at the meantime decreased plasma and liver glucose and lipid levels. The possible mechanisms involves remodeling lipid species, enhanced lipid metabolism, and PPAR activating. Besides our own work, our collaborators across the world also had some very exciting findings on omega-3 VOC PUFA. For example, Dr. Paul Burstein's lab from University of Utah found that chemically synthesized C32-6 improved the ERG response and visual performance in ELOV4 conditional knockout mice. And Dr. Dorota Skowronska-Krofczak from UC Irvine and found even more interesting because this is injecting directly the 24/5 into the eyes of the elderly mice. And it showed it improved their visions for up to a month. One shot, symptom improved for a month. Not only that, the fish oil industry in Norway also showed the safety of the omega-3 VOC PUFA-rich fish oil. All those efforts in medical research and technological innovations are creating a new generation of therapeutic approaches for treating AMD, age-related macular degeneration, and CVD, cardiovascular disease. So next, I'd like to talk about a brief history of fish oil and omega-3. Since the first study conducted in Greenland Inuit, 40 years has been passed since the recent REDUCE-IT study published. And our research in omega-3 VOC PUFA and omega-11 are just the beginning of exploring other bioactive lipids in fish oil beyond EPA and DHA. I promise no more data. This is a really last one. So I did not talk more, but we are actually also studying a very interesting omega-6 DGLA C23. Most omega-6 considered pro-inflammation, but this DGLA, it has very strong anti-inflammatory effect, and it may involve neural repair after a stroke and a possible treatment for atopic dermatitis. So we're actively seeking collaborations, and I'd like to talk more in detail with those who are interested after the meeting. So of course, without our wonderful team, multiple grant support, we cannot conduct all the studies. And I want to especially thank my mentor, Dr. Alan Rimale. Today also attended the meeting, and the great support from Nisei corporations from Japan. Thank you.